My name is Elise. I am a physical therapist. I'm also a certified exercise expert for aging adults. I'm going to stop right here. Lorene, are you recording? Okay. So I was working in home care for the last 5 years, seeing patients for physical therapy, and I came across that, it's hard whenever you're done with physical therapy and we discharge patients, and then what? What do they have to fall back on? A lot of these patients that I was seeing, they're not appropriate to go to the standard outpatient gym and whatever is out there in the community. Sometimes they just feel like they don't fit in the options that are available. So I decided to go off on my own and create something more for wellness, and I developed my company called Live Gracefully Physio and Wellness. So my company is very, very new to the area. I live in Brevard County. I want to focus more on wellness for the active adults to help manage chronic conditions. So that's a very large topic. A lot of people fall into that category. And I really just want to offer that help and support to fill that gap, because I saw there's a huge gap in care. A lot of the time patients will go to therapy and try it, and then there's nothing to follow up with, and then they end up back at their doctor, back in the hospital, and then the whole cycle starts again. So I want to try to offer some support and different things to do. So that's kind of how I came about. I put Coleman in that's my married last name, and you'll find that on Facebook. But legally for physical therapy, my name is still Pearce. That's my license name. So that's why I added both of those there.
Okay.
So the different services that I offer telehealth services. Obviously, that's a huge thing right now with COVID. I was looking into telehealth even before COVID. I actually signed up for a telehealth course. And some of the therapists I know have actually been providing telehealth services for 15 years. So in the realm of therapy, telehealth really is not new. It just became more well known to the community because of COVID. So it's actually been around for several years. So basically, I'm able to screen patients. A lot of times patients feel that, how is a therapist going to be able to help me without directly touching them, putting my hands on them to help them? And there's a lot of techniques that we can guide and educate patients on what to do. And it kind of makes the patient more independent in their care, because they have to take on that role of helping themselves through the guidance of the therapy. I also provide mobile therapy, and what that is, that's kind of like home health therapy, where I can go to the patient's house. However, it's billed under Med B, so it's billed a little differently, and you can't have a need for nursing care. So if you need nursing and physical therapy, then you need the traditional home health care, versus mine is billed a little bit differently. And then the last thing, like I said, my main thing I'm working on is wellness group exercise. So again, it's mostly online for right now. I was in touch with a therapist at New Wave Therapy here in town, and she's allowing me to use her clinic. But because of COVID and everything right now, everything is still online through Zoom. So that's a little bit about me. So with the company, how I came up with my name is, my goal is to educate and empower active adults to live gracefully. Now, what does that mean? You think of a dancer, and it's not just dancing. That's not the thing. I want you to make sure that you live well through your movement, through your posture, through your breath, and through your mindset. A lot of people don't realize how big of an impact your mindset can have on your recovery when you're dealing with something. So I really look at the person as a whole, and not just their main problem that they're facing. And so today we're going to talk about, like Lorene said, we're going to talk about progressive muscle relaxation. I like this picture. He looks very calm, little dog, whether it's a he or she, but that's the main thing, is we want to try to be relaxed. There's so much going on in the world right now that everybody is kind of in a little bit of a frenzy. So we want to try to see how we can just step back from the wild world that we're going through and focus on trying to relax. So this progressive muscle relaxation has been around for a long time, and it's good for a couple of different things that we'll discuss. So the purpose of muscle relaxation, what you do is you're going to tense a muscle and then you're going to relax the muscle. And with adding that, you're also going to work on breathing in between. Breathing is very important to allow your body to relax as well. So with this, this can help with reducing your stress, reducing anxiety, insomnia, and chronic pain. And specifically for people who are going through cancer, when we have pain, when we have stress, when we have anxiety, all these things kind of become this big bundle of what do we do with all this? You know, it's really hard to manage that. So sometimes the pain is not just physical pain. It can be emotional pain. It can be social pain because I can't get out. Like, pain is a very broad topic. So there's a lot of different techniques that you can use to help to work on pain, and this is just one type of technique. So it can help with a lot of different things, and that's kind of, I'm using this because it's an easy exercise, and it's a kind of a good icebreaker to kind of introduce myself and say, hey, this is one thing. So what this exercise does, so some people start from the top down. They start with their head, their face, and they work down to their feet. But most commonly, the exercise starts at your feet and works up to your face. So you're going to contract and relax each muscle group and one at a time. And I'll be taking you through this as well. This is just a guide to kind of to show you what you're doing. So you're going to work on your feet, your knees, your hips, then your elbows, your shoulders, your arms, and then your face.
Do we need to stand up for this?
No. So this exercise is done sitting or laying down in bed because you want to be in a relaxed position. You want to just be calm. So I usually tell my patients, this is really good to do like before you're trying to go to sleep at night, to lay down in bed, get comfortable, and then to do this exercise. It's shown that it can help with, you know, making you relax to help you to fall asleep easier.
Okay.
So it's either sitting or laying down. The diagram I have is just someone standing up.
Okay.
And then, like I said, it's very important to work on breathing. You really want to make sure that if you're feeling dizzy or lightheaded during it, you should just go back to breathing how you usually breathe. Everybody's a little bit different. So you don't want to be like forcing your breath to do it that way. And again, if any of the exercises when you're doing them, if they're painful or you're having a problem doing that, you can just skip that one exercise and go on to the next one with me. So it's not like, it shouldn't be painful. It shouldn't cause you any type of like stress. And if it does, then simply just stop. And some of my patients, they like to have something in the background kind of telling them what to do when they're doing it. So if you Google progressive muscle relaxation, there's a lot of videos. They actually even have videos for children to watch, to listen to. So there's many, many videos out there. It just depends on which one suits you that you like. So I recommend looking through the videos that are out there. And then if you have any questions to follow up with me after this discussion, you can reach out to Complementary Cancer Care. You can send me an email or you can find me on Facebook through Elise Coleman. And the last thing I wanted to show is this is like a research study, and it's supported by the American College of Sports Medicine. And it shows how exercise can be beneficial for those who are going through cancer. So at the top, it's kind of hard to see, it's a little fuzzy, but it says it can help with prevention of 7 common cancers, and those 7 are bladder, breast, colon, endometrial, esophageal, kidney, and stomach. And it helps with survival of 3 common cancers, and that's looking at breast, colon, and prostate cancers. So basically right now, there's a lot of push to try to get exercise as a standard of care for people who are diagnosed with cancer. They're trying to make it where as soon as you get that diagnosis, the very next day you're started on some type of an exercise protocol because they're seeing more and more in the research how it can be very beneficial to help, you know, limit some of the side effects from when you're going through cancer treatment, to helping with that recovery phase after you finish treatment. So it's very good that that someone tries to do something. And I always say, if you can't do like what they recommend, like doing 30 minutes a session, even if you can just start with 5-10 minutes and build up from there, a little bit is better than nothing at all. So that's kind of just to show you the research that's out there, and to see, I don't know, more and more research is coming every day. So do you have any questions with that?
It's a nice chart.
It is a nice chart, and I like the fact that it breaks down the difference, you know, between quality of life and anxiety and depression. It breaks that all down. And you can see the biggest thing, and I feel like a lot of patients, especially ones that have gone through breast cancer, lymphedema can sometimes be very hard to manage, because with the exercise, you know, you don't want to do something that makes that worse. So that's where the research, you can see it's kind of insufficient for aerobic exercise or combination. And then even with strength, they recommend it to be something that's supervised, because it can definitely trigger adverse, you know, effects. So you want to make sure that you're careful with that.
Okay.
So that is all for the presentation. So let me just exit out of that. Okay, you can see me again, right?
Right.
Okay, so I'm going to move my computer just a little bit here. And we're going to go through the exercises. And let me just fix my computer. It's wobbly. All right. So you can still see me okay? Okay. And so first, what we're going to do for the breathing is you're going to put one hand on your chest and one hand on your belly. And I want you just to analyze your breathing and see, where is your breathing coming from? Is it coming more from the hand on your belly or the hand on your chest?
Chest for me.
Chest for you? Yeah. A lot of that's very common. So if we're anxious, if we're just a shallow breather, a lot of people breathe only from their upper chest, use their accessory muscles. But we really want to try to breathe where we're getting that breath all the way down into our diaphragm, all the way down into our bottom hand. So first, we're just going to take a couple deep breaths and see if we can feel our bottom hand move. Can we take a deep enough breath where we feel that air go all the way down to our belly? So you're going to take a nice deep breath in and then breathe out. And at first, sometimes if you haven't used your belly muscles for a long time, it can be kind of hard to like even feel your belly muscles move when you're breathing, and that's okay. So then you're going to take another nice deep breath in and then breathe out. Can you feel a little bit of a difference from whenever you're trying to like take a deep breath versus just when you breathe naturally?
I can.
Yeah. So what we're going to do, we're going to use that deep breathing in between the exercises we do. So the first exercise we're going to do, you're going to take your toes and you're going to push your toes into the ground, kind of like you're digging your toes down through sand. So when you push down, you're going to breathe in, and then you're going to breathe out while you let the toes relax. And then you're going to push your toes down into the ground again while you breathe in. And then you're going to breathe out while you let your toes relax. And then one more time, you're going to push your toes into the ground when you breathe in. And breathe out as you let your toes relax. And then you're just going to take a moment and you're just going to relax and breathe normal, however normal breathing is for you. You're just going to relax for a second. And then the next one you're going to do, you're going to lift your toes up off the ground and breathe in. And then you're going to push your toes, your feet down into the ground as you blow out. And then again, you're going to lift your toes up off the ground and breathe in. And you're going to push your toes down to the ground and breathe out. And then one more time, you're going to lift your toes and breathe in. And then push your toes down and breathe out. And then again, you're just going to breathe normal, however normal breathing is for you. You're just going to relax. And then next, we're going to work our way up to our knees. So you're going to lift one leg out as you breathe in. And then let that leg slowly go back down as you breathe out. And again, lift that leg as you breathe in. And then slowly let that leg down as you breathe out. And then one more time, lift that leg and breathe in. And slowly let that leg down and breathe out. And then again, return to breathe however is normal for you. And then we have to do the other side. So the other side, we're going to lift the leg and breathe in. And then lower the leg and breathe out. And then lift the leg and breathe in. And then lower the leg and breathe out. And then one more time, we're going to lift the leg and breathe in. And lower the leg and breathe out. And then breathe normal. And then next, we're going to go up to our hips. So for this one, you're going to lift your leg up and breathe in. And then lower it like you're pressing down in the ground and breathe out. And then again, lift it up and breathe in. And then lower it down and breathe out. And then again, lift up and breathe in. And lower it down and breathe out. And then just relax a second. And of course, we have to do the other side. So the other leg, we're going to lift up and breathe in. And then lower it down and breathe out. And then we're going to lift up and breathe in. And then lower back down and breathe out. And then one more time, we're going to lift up and breathe in. And then lower back down and breathe out. And again, just breathe normal. So for the next one, we're going to move our arms and we're going to make a fist with our hands. So we're going to make a fist and we're going to breathe up and squeeze up as we breathe in. And then we're going to open our hands and let our arms come back down, like we're letting everything go as we breathe out. So we're going to make a fist and bring them up. Take a nice deep breath in. And then breathe out as we let everything go. Then one more time, bring them up as we breathe in. And then open them up and let everything go. And then breathe normal. The next one, we're just gonna bring our arms up to the side, just shoulder level, breathe in. And then breathe out, letting our arms come all the way back down. And again, bring our arms up as we breathe in. And let them relax all the way down as we breathe out. And one more time, lift them up as we breathe in. And let them all the way down as you breathe out. And then just relax. And then we're going to move up to our shoulders. So we're going to lift our shoulders up as we breathe in. And let our shoulders down as we breathe out. And lift our shoulders up as we breathe in. And let them all the way down. And one more time, we're going to breathe the shoulders up. And then let them relax all the way down and rest. And breathe normal. The last exercise is kind of funny for some of my patients. What we're going to do, we're going to just squeeze our face, squeeze our eyes, squeeze all our facial muscles like you're angry. Make an angry face, and then relax your facial muscles. And then again, squeeze everything. Squeeze your eyebrows, squeeze your mouth, squeeze your nose, everything. And then relax. And then one more time, squeeze your face. And then relax and breathe out. And just rest. And the last thing we're going to do, we're just going to focus our gaze up towards the ceiling. And we're going to open our eyes real big. And then we're just going to slowly let our eyes close. Bring them down and let them close. And then one more time, we're going to look back up to the ceiling. And we're going to let our eyes slowly close down. And we're just going to take a minute and relax. And breathe. All right. What did you think of that?
It put my husband to sleep.
I don't know if that's a good thing or a bad thing.
He did the first things with us, and then I looked over and his head's over asleep.
Yeah, no, it's something that's calming, it's soothing, it's easy enough for anybody to do. So it's something that's just, it's a basic thing. When I do my group exercise, it's a lot more, I would say, rambunctious. My group exercise is like movement to music, so it's uplifting and it's fun. It's something that is different than just sitting around and kicking your legs. So that's the difference. But because I didn't know who was going to join me today, I wanted to do kind of an icebreaker and do something very basic and easy. So that's why I chose to do that. Does anyone have any questions for me?
Yeah, I have a question. So if you're lying down, like let's say somebody is using this recording to help them go to sleep at night.
Okay.
So if they're lying down, would they start with their knees bent and then they would do the kicking out, straightening out, and then?
Yeah, I'll show you real quick here. You should be able to see me. So if you're laying down in bed, you can start however comfortable, whether your leg is straight or with them bent up. So if they're straight, you can still do the exercise where you bring your toes up and push back down. And then instead of the leg kick, you're going to do a heel slide, just up and back down. You don't have to do like the kick up and back down to the ceiling, but you could still do that. It just depends if it's comfortable or not for you laying down. So basically, if you're laying down in bed, I usually recommend just feet up and down, and then slide your foot up as you breathe in, and then slide your foot back down as you breathe out. And then you can still do the arm ones where you're raising your arms up and down here. You can still go out to the side, and you can still do the shoulder shrugs laying down.
Okay, thank you.
You're welcome. So yeah. Fran, did you have any other questions?
No, I don't, but it did feel good. And I'm not a good sleeper, so I'm going to start trying to do that at night.
Yeah, like I said, sometimes like they have a lot of apps, or they have different ones out there. If you just Google one, I tell my patients, if you have your phone or the computer, hit play, lay there and listen to what it tells you, because it will tell you like the different movements to do. That way you don't even have to think about like what's next to do. Okay. Another thing, I don't know like your history and like what you do typically, but another thing they recommend before you go to bed at night is to try to turn off the TV like an hour before you go to bed. Try to get up and walk a little bit before you go to bed to expend some of that energy. And then, you know, if you read, try to read, because that will help put you to sleep, things like that. But usually if you try some type of exercise, that usually will help a little bit with the sleep as well. And also make sure you're comfortable, make sure it's not too hot or not too cold, whatever you tolerate for the temperature, things like that.
And not have the computer on. That's my downfall.
Yeah.
Yelling from 11 to 1 a.m. and then I get in bed and my mind's all whirling,
Right. It's hard. It's hard for me too. My husband will be like, "Oh, you going to sleep?" I'm like, "Yeah." And the next thing you know, like for the next hour, I'm looking at my phone, just scrolling through Facebook or something like random. Like that's not going to do me any good.
No.
So yeah, I think we're all guilty of that.
Now, my daughter mentioned lately she had bought blue light glasses. Would that reduce enough of the blue light that you hear about on a computer screen that it wouldn't bother you as much? Or
so the blue light glasses are good for like eye fatigue or fatigue, because there's a lot of studies out there showing that the blue light can cause a lot more stress to people than like talking to someone obviously face to face. So they're saying like obviously now with COVID, so many more people are doing work from home, and it's actually more taxing and you get more fatigue from that because it's different. You're looking at the screen. So it's going to help with eye fatigue, but it's not going to make you sleep better by having blue light glasses. It won't really change. It's still that stimulation that you're getting to your brain. So that's what's still keeping you awake. So that's what they say, an hour before you go to bed, no TV, no computer, turn the lights down lower to try to shut your brain down. Because anything you're going to read or look at, it's going to just trigger your brain to keep thinking and keep processing more and more.
Yeah, I've been trying to practice that and read for like 30 minutes before. But usually I try to do a magazine or something that doesn't have me engaged, like a book that you really don't want to put down when you're reading it.
Yeah.
I think that's something.
Or like just try walking back and forth in your house for like, to say, I'm going to set the timer for 10 minutes. I'm going to just walk back and forth, or, whatever is comfortable for you, and just focus on your breathing, focus on yourself, reflect. Sometimes people who journal, that's a good time to journal even right before you go to bed, to get out whatever's on your mind. And kind of think about how your day went today and how your day is going to go tomorrow. It's a good thing to do that. And then it's something else that will get your mind going a little bit, but it won't be so much as everything we see out there on social media.
Yeah. And praying, always do that.
Right. So is there anything else I can help you with?
Me personally?
Yeah.
Oh. No, I just have had a lot of stress in my life with Cy in the hospital that week, and with a daughter whose job closed down, and she's interviewing all over the country, and now with Steph and the COVID. So I normally don't have that much stress in my life at one time, but right now I do. So the fact that this was to help stress reduction was interesting to me.
Yeah, to kind of work on that breathing, take a moment for yourself. Like you said, you feel like you're breathing a lot more through your chest than your belly. And so that's like, you have that tension then. Yeah, you're not getting that nice deep breath and to try to relax. So it's definitely something to focus on.
Yeah.
You still got to take a time for yourself, even though you're trying to worry about everybody else, right?
That's something I'm supposed to talk about when I talk about being a caregiver, is to find time for yourself.
And it's hard. It's very hard.
Yeah.
Yeah.
But I do have a lot of friends. I have a huge friend support in many groups, Garden Club and Red Hats and Bridge Club and all that. And we are Zooming now, since we're not meeting in person. And, one group is at 10 on Tuesday morning, and we're connecting that way. So that's been a big help, rather than just texting and emailing all the time.
Yeah.
So that's all we can do right now.
Yep. We gotta take one day at a time, right?
Yep.
Well, I felt really relaxed at the end of that. Like,
yes. I did
Good.
too.
Did you?
They've,
I
Good.
did.
they've actually done research that if you like check your heart rate and your blood pressure before and then check it again after, it can actually lower it a couple points. So it's easy enough to do. Like it's not something really hard, stressful. Some of my patients say, well, I don't exercise. I don't want to exercise. And they just get that anxiety thinking about exercise. So there's so many different things out there you can do for exercise and for people to help with different things. So, and that's my whole mission and my whole thought process is I want to be able to fill the gaps that are out there in healthcare because unfortunately there are a lot of gaps. So.
Right. So I, as physical therapist today, worked a lot on balance for him. And I tried one of the standing on one leg like a flamingo with your eyes closed. That is very, very difficult to do.
Yeah.
And not put your fingers on the sofa or something, you know, for balance.
Right.
But I think getting out in nature is important too, to see the sky and what you're seeing here on my screen. It really lowers my stress level a lot to do that.
Yeah.
So.
And that's where if you go back to the chart I posted about like stress and anxiety that they recommend, you know, the aerobic activity. And the best thing is to walk outside, you know, because you're getting that.
Except when it's
for
not
your
so
mind
hot.
to relax.
It's pretty hot right now to do that.
That's the only thing. Yep. But that's here in Florida. It's a little difficult, but.
We live close to Lowe's here up on near 95 in Rockledge. So I'd say 4 or 5 days we went over there in our walking clothes and went in up near the lumber section where nobody ever is. And we actually walked where it was cool. It was just too hot that week to walk outside. And well, someone told me that they didn't like you to do that, but they never said one word to us. They saw that I didn't have a purse on my shoulder, but nobody made any comments. So just not as good as outside, but it keeps you from fainting on the spot. So
right. So that's about all I have. If there's, like I said, if there's anything else I can do to help you, then feel free to reach out. And
what was your email again? Can you give us that?
Sure.
I missed it on the screen.
Sure. It's Elise. That's spelled Elise.
Yeah, I got that far.
At gracefulphysio.com.
And that's PHYSIO.
SIO.
SIO. SIO. .com.
Yes.
After that, okay. Okay. When and if we ever get back to our cancer support meetings, I would love to have you come in sometime. We think we're going to start up in September, and you could maybe tell the group. For some reason, they don't Zoom. I guess they're not into computers enough. So I haven't been able to engage them to get on here. But we do have every other month a guest speaker to come in. Would you be ever willing to do that?
Sure, no problem.
We usually run between 15 and 20 people now. So I'll be in touch.
No problem. Thank you for joining me today.
Thank you. It was wonderful.
Well, good.
Nice to meet you, Fran.
And you too. See you next week.
Yeah.
Bye.
Okay. Bye-bye.
Bye.
Well, if I can figure out how to leave. There.
I'm going to stop the recording.